So as of 2007, according to KaiserStateHealthFacts.org, over 45 million Americans are without health insurance. This is a significant issue in our country, and my main proposition for you tonight is how universal health care, in lieu of our privatized medicine system, would actually significantly improve the lives of the American people. Now, the definition of universal health care is federally funded health care coverage provided to all people. Now, the main supporting points I'd like to go over is, 1, how universal health care is more cost effective. 2, how universal health care reduces private employers' costs as well as employees' costs. And finally, 3, how universal health care improves people's quality of life. Now, how is it more cost effective? First, there would be no time wasted with paperwork for billing for insurance companies. According to Physicians for a National Health Program.org, private insurers unnecessarily waste health dollars on things that have nothing to do with care, such as overhead, underwriting, billing, sales, and marketing departments, as well as huge profits and exorbitant executive pay. And if we were to eliminate this, over $350 billion a year would be saved. The reason for this is because private insurance bureaucracy and paperwork consume about 1/3 or 31% of every health care dollar. Also, under a universal health care system, every individual is automatically covered. Because universal health care would be federally funded and not privatized, every single person in the U.S. would be covered by it. Greg Silva, an MD from the Physicians for a National Health Care Program, states that the U.S. spends about $7,129 per capita, and yet our system performs poorly in comparison and still leaves 47 million without health coverage and millions more inadequately covered. More than half, or 59%, of U.S. doctors actually favor switching to a national health insurance program, and fewer than a third, or 32%, oppose the idea, according to a new survey published in the Journal Annals of Internal Medicine. Universal health care would also be easily financed, relieving the burden that many American families already have in trying to pay for their health care. In addition, as stated by the Physicians for NationalHealthcare.org, they explain that universal health care would be financed in the following way. The public funds already funneled to Medicare and Medicaid would be retained. The difference, or the gap between current public funding and what we would need for a universal health care system, would be financed by a payroll tax, which on employers would be about 7%, and an income tax on individuals, which would be about 2%. The payroll tax would replace all other employers' expenses for employees' health care and would be eliminated. It would also take place of all current insurance premiums, co-pays, and out-of-pocket payments. And for the vast majority of people, a 2% increase in income tax is less than what they're already paying for their insurance premiums or co-pays. Now, on to my second main supporting point is universal health care would reduce private employers and employees' costs. Companies do not need to supply health care to employees, which would be a significant cost saving. And John Arvidsson, MD from the New Milford, Connecticut, explains that the U.S. spends twice as much per capita on health care than any other industrialized countries, and 30% more than the second most expensive country in the industrialized world. If companies were to eliminate their expensive healthcare costs, then they could actually put money back into their businesses. And coverage would actually stay with employees who are laid off because it would be federally funded. Jackie Lohman from WisconsinCleanElections.org states that when people change jobs or are laid off by their employer, they do not lose their health care coverage. It stays with them, and they do not have to worry about being denied by a new employer's plan because of a pre-existing disease. And for my third main supporting point, universal health care would improve people's quality of life. Federally funded means people could receive health care in any state at any health care facility. People can continue to see their own physician because, as Dr. Gordon Schiff from PHPN.org states, a single-payer system would allow patients to choose their physicians and continue to see them if they change jobs or financial status. No other proposal can assure this. This continuity of doctors and nurses who can get to know and care about patients is critical to quality, but is rapidly disappearing from the medical landscape as HMOs, insurers, hire and fire physicians, and employers shift plans to take advantage of the lowest price each year. And also, there would be no concern of receiving bills for costly procedures. The National Coalition on Healthcare states that 1 in 4 Americans say their family has had problem paying for medical care during the past year. which is up about 7 percentage points over the past 9 years. Nearly 30% say someone in their family has delayed medical care in the past year, which is a new high based on recent polling. Most say the medical condition was at least somewhat serious. And also nearly 1/4, or 23% of the uninsured, reported changing their way of life significantly in order to pay their medical bills. I have spoken to you tonight on the aspects of a universal healthcare system and the benefits it would provide to the U.S. society. I've explained how it would be more cost effective, how it would reduce private employers and employees' costs, and it would improve people's quality of life. I hope that through the examples and evidence I have provided to you tonight, you would agree with me that universal health care in place of privatized health care would benefit the American society greatly.